Okay, all right, we're going. Okay, all right. Hi, my name is Jackie. I'll be your provider today. What brings you into the office?
I'm just here for my yearly checkup.
Okay, great. So we'll get started with the physical exam. The patient is well appearing, awake, alert, on inspection. Skin color is appropriate for ethnicity. And then the skin on the patient's head and face is intact and free of lesions. Do you mind if I just palpate your scalp?
No, go ahead.
Okay. Does anything hurt?
No.
Okay. Patient's scalp is non-tender. Patient's face is also symmetrical. Let's see what else. Can you raise your eyebrows? And can you frown? Smile. And then I'm just going to ask you to close your eyes and now open them. Okay, great. So cranial nerves 5 and 7 are intact. And can you feel me touching your face?
Yes.
Okay, great. Cranial nerve 7 is also intact. Now I'm just going to palpate some muscles on your face. Let me know if you have any tenderness. So these are the masseter muscles of your jaw. Any tenderness?
No. Okay,
great. And then I'm going to palpate around your eyes. These are the temporal muscles. Any tenderness?
No.
Okay, great. All right, so I have a little Snellen eye chart set up. It's 6 feet across from you, so it'll be an accurate representation of your visual acuity. So read the smallest line possible. Oh wait, cover your left eye first.
DHJBS.
Okay, great. Patient's right eye has 20/40 vision. Now cover your right eye and try reading the smallest line possible.
DHJBS.
Great. The patient's left eye also has 20/40 visual acuity. Okay, so now I'm just going to shine a light in your eye to test your corneal reflexes. You don't have to do anything, just stare straight ahead. Okay. Okay, great. The corneal reflexes are equal and present bilaterally. Now I'm just going to have you cover your left eye and just stare straight ahead. Okay, now uncover. Okay, now cover your other eye and uncover. Okay, great. So the patient, both eyes remain staring straight, which indicates no ocular muscle weakness. So now I'm just going to have you follow this pen just with your eyes without moving your head. Okay. I'm just going to bring it closer to you. Further away. Okay, perfect. Okay, so cranial nerves 3, 4, and 6 are intact with no extraocular weakness. Eyes are symmetrical in proper alignment. The eyelids have no lesions or crusting noted to them. The lacrimal apparatus and conjunctiva have no drainage or erythema. The sclera is white and non-erythematous. And now I'm just going to check your pupil reaction to light. So just go ahead and stare straight ahead. Okay, pupils are round, equal, and reactive to light bilaterally. Now I'm going to check the red light reflex, look at your optic disc and retinal background. So just stare straight ahead. Okay, the red light reflex is present. The optic disc is round and pink. The retinal background contains veins and arteries with no abnormalities. Now we're going to switch to the ear exam. Okay, on appearance, the ears are symmetrical and in proper alignment. I'm just going to palpate your ears. Let me know if there's any tenderness. Any tenderness?
No.
How about here?
No.
Okay. No tenderness to the tragus or the pinna. Now I'm going to look in your ears with my little light. I'm going to check for your tympanic membrane.
Okay.
Okay, great. Okay, tympanic membranes are pink and pearly with cones of light at the 7 o'clock and 5 o'clock position. There's no drainage, erythema, or bulging membranes present. Let's see what else. Okay, the nose is symmetrical with no lesions present. I'm just gonna touch your nose, let me know if there's any tenderness.
No.
Okay, and then I'm gonna palpate your sinuses, let me know if there's any tenderness.
No.
No? Okay. Anything?
No.
Okay, so the frontal and, let's see, I lost my place. The maxillary and frontal sinuses are non-tender. The nose is non-tender. And now I'm gonna just briefly look into your nose to see if there's any drainage or septal defects. So just look up for me. Okay. The nasal cavity is patent. There appear to be no septal deviations, and there is no drainage present. I don't have anything for you to smell right. Oh, here. Okay. All right, these are mints. Can you smell these?
Yes.
Okay, patient has intact sense of smell, which is cranial nerve 1. Mouth and throat are symmetrical with no lesions present. No odor noted. I'm gonna have you open up your mouth and just say ah. Great. Okay, perfect. Okay. Buccal mucosa and gums appear pink and moist. Teeth are intact with no cavities present. I'm gonna ask you to stick out your tongue. Move it from the left, now the right. Okay, great. Cranial nerve is intact. And on appearance, the hard palate appears pale pink and the soft palate appears a normal pink color. The tonsils are present with no erythema or exudate. Let's see. I'm just gonna have you taste this mint. Can you taste it?
Yes.
Okay, perfect. Cranial nerve 9 and 10 are intact. And then now I'm gonna palpate your lymph nodes.
Okay.
Okay. Do you want to spit the mint out? No, they're really strong. You're doing good. Okay, now I'm gonna palpate your lymph nodes. You have your oh, I'm sorry, I shocked you. Your pre-auricle, post-auricle. No. Okay. Lymph nodes are soft, mobile, non-tender, with no swelling present. I'm just gonna feel your trachea. Okay, and now your thyroid. Okay. Any tenderness?
No.
Okay. Trachea and thyroid are midline. There's no swelling present. And now I'm just going to listen over the thyroid and your carotid artery. So just breathe normally. Okay. Okay, great. There's no bruit heard over the thyroid and carotid arteries. Now I'm just going to look at the back portion of your chest. So I'm just gonna have you scoot your chair this way. Or yeah, just sit that way. Yeah. Okay, perfect. Okay. So just breathe normally. I'm just gonna put my hands on your back. Take a deep breath. Okay, thoracic expansion is symmetrical. I'm gonna put my hands on the top of your back. Say 99 for me.
99.
Okay, and now say 99 again.
99.
Okay, there's no increased or decreased tactile fremitus. And now I'm just going to tap. Okay, there's normal resonance present with normal percussion. Okay. And now I'm going to listen to your back. Just take normal breaths. Okay. Diaphragmatic excursion is about 4 centimeters. Okay, now I'm just gonna listen to your breath sound, so just breathe normally. Okay, great. The upper and lower lobes are clear to auscultation bilaterally with vesicular and bronchovesicular breath sounds heard. Okay, so the posterior chest appears symmetrical. The anterior chest also appears symmetrical. Patient's respiratory rate is about 20 breaths per minute with a regular pattern. I'm gonna palpate. Any tenderness?
Mm-mm.
Okay, no tenderness noted to the anterior chest. Take a deep breath for me. Okay. Thoracic expansion is symmetrical. Now I'm gonna listen to your breath sounds on the side. So just breathe normally. Okay, deep breath. Deep breath. Again. Okay, now I'm gonna go on the side. Okay, now this side. Okay, good. Okay, so the upper and lower lobes bilaterally are clear to auscultation with vesicular and bronchovesicular lung sounds heard. Okay, now I'm gonna listen. We're at the cardiovascular portion of the exam, so I'm just gonna have a listen to your heart sounds. I'm gonna listen to the aortic valve heard at the second intercostal space on the right sternal border, the valve at the second intercostal space on the left sternal border, Erb's point at the third intercostal space at the left sternal border, tricuspid valve at the fourth intercostal space at the left sternal border, and the mitral valve at the fifth intercostal space at the mid-clavicular line, which is the point where you can hear the heart the best. So I'll listen to all of those and just breathe normally. And then just go right there. Okay. No adventitious sounds are heard. S1 and S2 are clear. And now I'm just going to look at your jugular veins just to make sure there's no distension. So just lean it back in the chair a little bit. Okay. All right, there is no jugular venous dissension present. Now I will inspect, auscultate, and palpate the aortic, renal, iliac, and femoral arteries. So they're kind of down here. Okay. I'm going to listen. Okay, good. Okay, there is no thrill to palpation and no bruit to auscultation. And then part of the last portion of the exam is I'm just going to feel your pulses and check your capillary refill. So I'll check with the radial. Okay. Okay, radial pulses are +2 bilaterally. Now the brachial. Okay, brachial is +2 bilaterally, and then I'm just going to go behind your knee for the popliteal. Okay, and now the other leg. Okay, popliteal is +2 bilaterally. Now I'm going to go down by your feet for the tibial. Okay, tibial pulses are +2, and then can you take your shoes off for a second? Okay, these are your pedal pulses. All right, pedal pulses are +2 bilaterally, and then I'm just going to squeeze on your fingernails to make sure you have good capillary refill. Okay, and then, okay, capillary refill is less than 3 seconds on the upper extremities bilaterally, and capillary refill is less than 3 seconds on lower extremities bilaterally. Okay, let's see. All right, so all normal exam findings. Do you have any questions for me today?
No.
Okay, all right, thank you.
You're welcome.
Good job.